The third vital sign is respiration. Respiration refers to a person's breathing and the movement of air into and out of the lungs. Inspiration refers to the process causing air to enter the lungs, and expiration refers to the process causing air to leave the lungs. A respiratory cycle, i.e. measured as one breath for the respiratory rate, is one sequence of inspiration, and expiration, i.e. the chest rises and falls once. The quality of a person's breathing is normally relaxed and silent. However, loud breathing, nasal flaring, or the use of accessory muscles in the neck, chest, or ribs is a sign of breathing problems that are referred to as respiratory distress. People who are experiencing respiratory distress naturally assume a tripod position, meaning they lean forward and place their arms or elbows on their knees or on a bedside table to help improve lung expansion. If a patient is demonstrating new signs of respiratory distress as you are obtaining their vital signs, immediately notify the nurse. Respirations normally have a regular rhythm in children and adults who are awake. A regular rhythm means that the frequency of the respiration follows an even tempo with equal intervals between each respiration. However, newborns and infants commonly exhibit an irregular respiratory rhythm. Normal respiratory rates vary based on age. The normal resting respiratory rate for adults is 10 to 20 breaths per minute, whereas infants younger than 1 year old normally have a respiratory rate of 30 to 60 breaths per minute. Respiratory rate varies greatly from infants to adults. In general, report an adult's respiratory rate immediately to the nurse if it is less than 10 or greater than 20. When obtaining a respiratory rate, the most accurate measurement is obtained when the client is not aware you are watching their breathing. Knowing they are being observed can unconsciously change their breathing pattern. For this reason, many nursing assistants count the client's respirations while they appear to be taking their pulse. This is one exception to the standard rule of explaining to the client what you will be doing. When counting respirations, it can be difficult to see a complete respiratory cycle. Respirations can be observed by looking at the client's shoulders move up and down with each breath, the stomach or chest rising and falling, or the clothing around the ribs moving. You may have to ask the client to remain quiet while respirations are being observed because talking or moving changes the respiratory rate. Respirations are documented as the number of breaths per minute, with each cycle of inspiration and exhalation counting as one breath.